So we'll discuss now what are the drugs which are used in cough. So before discussing the drugs, first we will understand little about what is cough. Cough is basically a very protective mechanism which are designed by our body. So it is a protective mechanism. What happens? Why this cough is important? So it is protective for our body. Whenever we inhale the foreign particles, like anything we inhale which is not required by our body. So suppose we inhale the foreign particles, it will goes inside our lung. It tries to goes inside our lung through our throat, and then it goes to our respiratory passages, and from the respiratory passage it goes to the lungs. So if it is not required by our body, there are certain receptors which on seeing these foreign particles they get activated. These are present in our throat and in our respiratory passage. These are the chemoreceptors, or they are also called mechanoreceptors. And some of the receptors are also present on the lung, that are the stretch receptors. So if these foreign particles goes inside through the respiratory passages, these mechanoreceptors, if they are not required, they start getting stimulated. These stretch receptors and mechanoreceptors are the chemoreceptors. They give the signal, very powerful signal, to throw these foreign particles out of the body. So it is important because we don't require these foreign particles. These are not required for our lungs, which are not good for our lungs. So this is important mechanism. That's why the things which are not required by our lungs, they are thrown out. So this way the protective mechanism. This way cough helps in removing the foreign particles which are not required by the body by the stimulation of receptors like the chemoreceptors and the stretch receptors. Chemoreceptors are located on our throat and respiratory passages, while the stretch receptors are present inside the lung. Now also what we have to understand here, what type of cough we are going to suppress. If it is dry cough is useless cough, it is not required. It is unnecessarily creating trouble for the patient. Patient keep on coughing and start having a lot of musculoskeletal pain and other symptoms. So dry cough is non-specific, it needs to be suppressed with the use of drugs. But if the cough is wet, that means it contains some secretions, and if the secretions are there, it will remain in the lungs. If we suppress these secretions, then what happens, that it will collect in the lungs and that will create infection. So wet cough does not need to be suppressed. We have the patient, if can throw this cough out, it is good. We don't need to suppress it. We have to find the underlying cause of the wet cough and then we will treat it. But for the dry cough, we can suppress it. So let's study the classification of drugs used for cough. We have the demulcents, we have the expectorants and antitussives and adjuvant antitussives. So these are the groups of drugs which are available. So first talk about the demulcents. So what these demulcents do? Whatever, first we should know whenever there occurs the cough, because of excessive coughing, there occurs the inflammation in the throat and in the respiratory passages. There is a lot of inflammation, and these inflammatory signals, the irritated throat and irritated respiratory passages, they send the signal to our brain, and because of which the patient experiences pain in the throat and in the respiratory passages. These are the afferent impulses which are carried to the brain by the excessive coughing. Afferent impulses. So what happens when we give demulcents to the patients, these afferent impulses is being blocked from the throat and the respiratory passage, and the patient will having very soothing of the throat and the pain signal gets stopped. This is how the demulcents acts. They basically block the afferent impulses that is going to the brain from the throat and the respiratory passages, and the irritated throat and irritated respiratory passages, they become less of the inflammation. Inflammation goes very down, and the patient gets relieved of pain in the throat and other symptomatic relief. They are basically providing symptomatic relief to the patient. Now about the expectorants. How does these expectorants are also called mucokinetics. So what happens when patient is having cough, they are basically having some secretions which are being stick to the respiratory passages. There are certain secretions which are being stick to the respiratory passage, and these patients have constant desire of coughing again and again. So what these expectorant group of drugs do, they basically break down these mucus secretions. They break down these secretions, and also they enhance the bronchial secretion from the bronchial. There are a lot of glands present in the bronchial tree, and they try to increase the secretions in the bronchial tree. They increase the lot of secretions, and they break down these mucus plugs. And because there are a lot of secretion and there is breakdown of the mucus, and when patient tries to cough, these material which are being collected in these respiratory passage, they easily pass out through respiratory passages out of the body. So in this way, the expectorants helps in clearing the airway. Now about the antitussive group of drugs, they basically act at the central nervous system. So normally what happens, these are our lungs, these are the brain. So what happens, this brain sends the signal to our respiratory tract for initiating the cough whenever we inhale the foreign material. Also in the lung also gets stimulated by foreign material. There are peripheral action also. So these antitussive groups of drugs block these signals from the brain to the respiratory tract, and because of which the respiratory tract is unable to initiate the cough. So antitussive cough act at the central nervous system level mostly, and also at the peripheral level. They basically block the signal from the brain to the lung to initiate the cough. So because of which cough is not initiated, and the patient gets relieved of cough. They are basically used for dry cough. It is not good for initiating and giving the antitussives for wet cough. About the adjuvant group of drugs. So what happens during coughing, this is bronchus which takes the air into our lungs. So in some cases of cough, there occurs the bronchospasm. Or bronchoconstrictions. So this adjuvant group of drugs, they dilate these bronchus. They cause the bronchodilation. Because of bronchodilation, there is easy movement of the secretion out of the body, and the patient gets relieved of coughing. So they also provide a symptomatic relief mostly. They are to be used only when the component of bronchoconstriction is present. First talk about the pharyngeal demulcents. So as we already discussed, they basically block the afferent signals. So what happens whenever we cough? There are the signals which are coming from the throat and the respiratory passages. There are the signals which are coming from the throat and our respiratory passages. These signals are very painful and causes pain in the throat and the respiratory passages. There is a lot of pain, and these afferent signals are being blocked by these demulcents group of drug. They block these afferent signals, which is going to the brain. They basically soothe our throat and provide the symptomatic relief. The drugs in this group, we have the lozenges, we have the cough drops, we have the lintasis, glycerin, and licorice. So these are the group of drugs which are called the pharyngeal demulcents, and they provide a symptomatic relief to the patient.
Talk about the expectorant group of drug. These are also called as mucokinetics. They are also called as mucokinetics. So what these expectorants group of drug do? First, we understand what happens in patient who is having a lot of cough. There are a lot of secretions which are being collected in their respiratory passages, and they are unable to remove the secretion out of their respiratory tract, and because of which they have constant desire to cough. They have sticky throat. So what happens? What these drugs group do? They will try to break down these secretions. They try to break down these secretions. The drugs in this group which try to break down these mucus secretions, they are called as the mucolytics, and also they also induces the fluid material in these secretions because of induction of the fluidity in the material here in this respiratory passage, and also because of the breakdown of this mucus, because of which there is a lot of liquidity formed in this area, and this helps in easy clearing this material from the respiratory tract, and the patient gets relieved of cough. And the drug which increase the bronchial secretion, because there are glands which are present in the respiratory tract, they enhances the secretion from this gland. They are called bronchial secretion enhancer. In this group we have the sodium and potassium citrate, potassium iodide, and guanfacine. And in the mucolytics which try to break down these mucus here, these groups include promexine, ambroxol, acetylcysteine, and carbocysteine. So because mucolytics try to break down the secretions, and bronchial secretion enhancers increases the fluidity content in the respiratory tract, this will help in easy removal of the secretion from their respiratory tract. So in this way, mucokinetics are the expectorants act.